And when you pull, it should unravel like that. And you do it in a quick motion, and you'd see all that blood flow right back up into there. I don't have a model to do this on, so I'm going to do it to myself. We are going to wrap this string wildly tight along my finger here. It's going to leave a mark for sure. Make a loop like this. You're going to place this loop, again, I don't have a model to do this on, so I'm doing it on myself, on the person's finger, and you're going to start like this. Boom, just like that, and you slowly but tightly wrap down the finger from the tip. Don't start at the base of the finger and go to the tip. Don't ever do that. Do it tight, but I mean, don't like absolutely make it excruciating for the person or for yourself. Basically pushing all the blood flow back down into my hand. You don't want to start here and push all the blood to the tip of your finger. Don't do that. So you're going to get a really tight sensation, and what you want to do is try to bend your finger around, bend at the knuckles. It's not going to feel super comfortable, and you're going to want to squeeze around, pinch it. It's going to be a big increase in sensation everywhere that you try to bend and touch along this finger. After you do that for a minute or two, you're going to get a hold of the end rope here, pull it out fast. You want to make sure you leave enough string here and that it's slightly loose enough here so that when you pull, that it will come undone. And when you pull, it should unravel like that, and you do it in a quick motion, and you'd see all that blood flow right back up into there. This zebra pattern will go away, don't worry. And your finger's gonna kind of look like that. Or your patient finger. So we do this on people who have diminished sensation in their hands, particularly their fingers. What this does is it increases sensory input, deep sensory input, all over that finger and into the joints. So the proprioception is really getting hammered here, and everywhere you're touching, it's really just lighting up a lot of sensory input in there. And then when you release the string, the blood flow releases back in there, and that combination of that proprioceptive force lifting off and the blood filling back in kind of has a really illuminating effect on your senses in there. And for a lot of people, they will notice they have a big increased sensation in that finger that they probably haven't had a lot of sensation in a long time. Some patients I do this on, they say they've had a pretty numb finger for longer than a year, and we do this and now they have some sensation. It doesn't mean that that sensation is going to stay there now for the rest of their life, but it's a good indicator that there's other things we can do to keep working on it, and that there's improvement that can be done there. So this is called finger wrapping or string wrapping, and we do it, I do it fairly often. People are usually pretty skeptical as I'm doing it, because it's pretty wild. And after we're done, we go through all the fingers and they all look like this, and they've got a little bit of a mark on them. Pretty wild the way it works. Again, this is jute string that we use. Other strings will probably cause a burn as you wrap it tight and pull. Jute does a good job of keeping everything safe. Give it a try and see if it works for yourself, if you're somebody who has some diminished sensation, or for your patients. See if that gives you a little more insight into things that you can do, if it's worth working on more sensory things on the distal hand. Again, this isn't something that's going to solve numbness in somebody's fingers, but it will give you a really good indicator that it's worth pursuing more treatments and modalities to bring more sensation back, and that it'd be worth your time to focus on it. Give it a shot.